For our movie presentation, we chose to watch Catch Me If You Can. This presentation will be presented by Arely Sanchez and Sofia Chapa. Frank Abagnale Jr.'s character was highly successful in executing several high-profile identity fraud schemes. His actions were motivated by personal need, adventure, and seek praise from his father. The culture environment during Catch Me If You Can was set in the early 1960s post-World War II. During this time, optimism and economic expansion played a big part in the environment, while looks and qualifications were highly valued within the culture. This gave Frank the upper hand within the system to characterize himself during a time communication and technology were not interconnected, which enabled Frank to successfully impersonate a Pan-American pilot, doctor, and lawyer. The mental disorder Frank suffered from was antisocial personality disorder, or ASPD for short. ASPD is best described as a mental illness that shows a person continuously disregarding socially correct behavior and feelings of others. The impact of the culture allowed Frank's psychopathic behavior to thrive, since at the time trust, authority, and value were valued more than personal integrity. If Frank were to have went to a therapist during the 1960s, they would most likely diagnose him with ASPD, since the term was introduced around 1968 but was very broad and still developing. When it comes to ASPD in other cultures, I would say it's acknowledged as a mental disorder in developed countries, while in underdeveloped countries it is seen as an exaggerated self-perception. A few stigmas ASPD is known for is being evil and associated with criminal and violent behavior, which causes proper treatment and resources for people with this disorder to be denied.
Evidence to support Frank has antisocial personality disorder include him taking part in law-breaking. He did not have any money, and therefore he would forge checks from other people's accounts so that he can obtain cash from the bank. He also talked his way into making people think he was a doctor, lawyer, and pilot. This was all for personal gain. Frank showed impulsive behavior throughout the movie as well. As the FBI was looking for him, he would move across the United States back and forth into multiple countries in Europe. He would drop everything and leave because he knew the police would always be one step behind if he did this. To top it all off, he would call the FBI agent in charge of catching him. Frank just wanted company. He wanted a family dynamic and wanted to be loved. A symptom Frank does not show throughout the movie is anger. His emotions were down to earth. He did not have an aggressive personality. I would propose treating this condition through psychotherapy, or more specifically cognitive behavioral therapy. By doing so, the patient is able to manage their issues by changing the way they think and behave through talking to a licensed professional. It is suitable and appropriate because it allows Frank to take the time to reflect on his destructive and damaging behavior. He was always go, 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 and never think and reflect. Some ethical concerns for the treatment include confidentiality. As Frank or the patients talk about what they have done, the therapist or outsiders may spread this information. Maintaining boundaries can also be an issue, as information said or asked can be off-topic or hurtful. This is still a relationship among people. Sustaining rights and autonomy of the patient may also be violated, as the other party is trying to obtain information. Lastly, barriers that may prevent Frank from getting the support he needs is simply lacking support. He committed a handsome amount of crimes. He is a walking convict. People may rather him be locked up due to fear. General public would not encourage this. Also, the movie takes place in the 1960s, where men's mental health was not prioritized, and therefore gender stereotypes may be an issue.
Catch Me If You Can was an accurate portrayal of ASPD because in the film they showed spot-on behaviors such as manipulation, charisma, and impulsiveness. They showed how Frank was able to be charming and socially skilled while lacking remorse and cooperation. The film's influence on our understanding was very superficial, since it covers more criminal behavior and personal charm and not really clinical observation of ASPD. Overall, the film associates ASPD with dangerous behavior when the spectrum for ASPD is so huge and not everyone with ASPD is considered dangerous. Here are the references we used.